Creating the Facility Environment, Part 2. The Administrative Medical Assistant's Role. This person should keep a positive attitude, smile. The Administrative Medical Assistant is a person who sets the tone for the office visit, whether on the phone or in person with the patient. The Administrative Medical Assistant duties may vary. They may have to show very ill patients to a separate area from the rest of the patients, may have to ask them to put on a mask. They may have to monitor waiting children. You want to keep the area of the reception tidy, straighten up magazines, clean up litter, clean surfaces. Notify tactfully the patients of any delays in the schedule, maybe offer them an alternative appointment if there's going to be much of a wait time, because the patient's time is as valuable as the doctor's. So it's nice to let them know that there may be a wait time, and if they want to reschedule, they may be able to do so. Calm frustrated patients if necessary. When you're opening the facility, everything should be ready. There should be a visual check of each room. The room should have a comfortable temperature. They should be well organized, pleasantly illuminated, spotless, and all your equipment should be up and running. You may have to do quality control checks at that point and put into your logs your results. Check the answering machine, retrieve any messages, retrieve any charts if you're still using paper charts, and make phone calls back to patients that may be waiting for a phone call back. When you're closing the facility, you want to check each room, secure all doors and windows, shut down your equipment, secure your confidential materials and records in a locked cabinet, make sure that you comply with all Controlled Substance Acts, prepare the day's receipts and bank deposits. Ready each room and area for the next day. Notify the service that the office is closed and where and how to contact the medical staff in case of an emergency. This is letting them know who the doctor may be on call for the evening. The future environment for the ambulatory care setting. It is predicted by the year 2020, 40% of providers' time will be treating members of the aging population. Patients who are 85 years or older have increased by 50%. The baby booming age is upon us. Medicare reimbursement will continue to be a struggle. Patients will seek medical care that is close to bus lines and where they can take care of all their many medical needs in one place. Labs, pharmacies, see the doctor. All of that can be done under one roof versus them going from one doctor to another place to get blood drawn, to another place to get their medications filled. Frustrations with medical care can be lessened. Provide clear, concise written instructions. It's very important that especially our older population of patients understand what has gone on. They may not remember what the doctor might have said earlier on in their visit, so sometimes giving them written instructions on what the doctor wanted them to do is the best way to ease those frustrations. Create an environment allowing ease of movement from one department to another. Make sure there's signs or escort them to the other department if the need arises. Make sure patients understand prescription instructions and directions. This is very important, and it's very important that they understand how to take it, when to take it. Remind patients of when they are to report back to the provider for follow-up. Make sure that they make an appointment before they leave. That is the best way to make sure that a patient will return for their follow-up visits. The AMA predicts increase in online treatment for patients. We are in the computer age. With government mandates, electronic medical records for most offices are going to be in place by the end of 2014. E-prescribing of prescriptions was mandated in 2011. Some prescriptions are still hand-delivered to the pharmacy because they are controlled substances and cannot be e-scribed.